With the toll of swine flu deaths going up to 11 in Telangana, the state government continues to say that the numbers are not alarming. In 2014, 88 cases of swine flu were reported in Telangana and Andhra Pradesh together. Of them, 22 were reported in the last week of December alone. Around 10 people reportedly died of swine flu last year. Now, swine influenza, also called pig influenza, is an infection caused by any one of several types of swine viruses. Noting that swine flu is not a life-threatening disease, the Health Department of Telangana had said that the government had taken various steps for checking the spread of the disease. All right, Jugal joins us from Delhi. Ratnika joins us from Hyderabad. Jugal, let me come across to you. What really is the level of preparedness here in Delhi as far as swine flu is concerned?
Well, Sanket, only in the last week of December, we had the first casualty of, of a woman out of swine flu. She was a resident of Ghaziabad, and it's only after that, in the entire of 2014, 35 cases in Delhi itself were reported, which amounts to more than almost 3 cases, per month. And the health minister spoke out just about a couple of days back, giving an overall review of just what are the level of preparedness that the government has displayed. He's saying that all the hospitals, the public hospitals in the NCR region are equipped to deal with it. 18 hospitals specifically are equipped to sort of deal with the most serious cases. Any case which has been referred to can be dealt with in Delhi itself. But Sanket, since the number has gone up so high, and even though the government may not admit it, but there are now persistent calls coming from the medical fraternity that perhaps it is time to take a level above in terms of the kind of preparedness that the state shows. Back to you.
All right, Jugal, let me quickly now go across to headlines today's Ratnika joining us from Hyderabad. Ratnika, the death toll there or the number of cases reported also are very high. But the Telangana government, it seems, says that everything is in control. What really is the mechanism that has been put in place, or is the state government living in denial?
Well, Shiv, it is true that the death toll is also rising, and also people actually testing positive for swine flu is also rising. But surprisingly, in an emergency meeting that happened on Wednesday between the state health ministry and the doctors, the government decided that it's not, there's no need to push the panic button as yet, because they have all the medical equipment and all the medicines, in fact, in place to tackle swine flu. But yesterday, 2 more cases of swine flu was reported in Hyderabad, and in fact, today I was talking to a relative of another patient who suspected to have swine flu yesterday. Last night, in fact, she was admitted in the Gandhi hospital. Her swab tests are happening. Sputum was taken for testing whether it's positive or negative for swine flu. But the doctors suspect that she may have swine flu, and today by afternoon we'll know. So the toll, of course, is increasing, but the government says that they have all the mechanisms in place. They ensure that the relatives and the family members of the patient are also given medication, and they also have a state surveillance system set up which go around at various places where swine flu is more likely to be occurring, and in those areas they've actually set up surveillance systems. So that's the kind of mechanism that the government is having, but it's really surprising that they still don't think it's time to push the panic button. Back to you.
Ratnika as well as Jugal, thanks very much for joining us.